Welcome to Needham School Spotlight. I'm Dan Goodicant, Superintendent of Schools. We've begun another school year and again focused on health and safety as a priority. And joining me today to talk about some of our health and safety protocols, procedures, and the news are three folks who really are helping to lead efforts in the community. I want to thank Tim McDonald, the town's Director of Public Health and Human Services. I want to thank Susanna Hahn, our interim and new Director of Health Services, and of course, school physician Alan Stern. Thanks to all of you for being here. I got that title right, didn't I?
You did.
Okay, good. I feel good about that. Susanna, welcome to Needham.
Thank you.
You found us a little late in the summer, which we are thrilled that you have joined us, particularly at this really, really challenging time. So what have you been learning about the community so far?
It's been a really warm and welcoming community. I've really enjoyed all of the staff and the families that I've interfaced with. And in this moment, really working together to get through the school year. The school nurses are working really hard doing their normal day-to-day work, as well as supporting the families and the staff around COVID protocols. So it's a busy year, but wonderful people to work with.
Well, I appreciate that you have jumped right in, and it's really become kind of a 24/7 commitment for you. I only know that because we're texting throughout the weekend and in the evening or on the phone, and I know you're doing that with your nurses as well, who are all working. So we're glad you're here, and thanks for helping lead this effort around health and safety in our schools. Tim, I'm wondering if you could share with us what's the big picture in Needham regarding COVID. You have the responsibility for thinking about the entire community, and in the schools we have this work going on, but the community there's more work. So what's happening with COVID in Needham?
Sure. In Needham, we're cautiously optimistic, and there's a couple reasons for that. Our case level is pretty steady, and it's at a low to manageable level. But the primary reason we're optimistic is we have a very highly vaccinated population, and that is true across all age groups. We're in an exciting position where today, this afternoon, we're starting booster clinics for those people who are 65 and older, or those people under 65 with severe immunocompromised conditions, or people that are in frontline roles such as teachers, healthcare workers, and public safety personnel. So it's exciting that we're starting booster clinics. We're going to be even more excited when vaccine is available and the emergency youth authorization is extended so that people under the age of 12 can be vaccinated.
When do we think that's going to happen? Do you have any insight in that, Dr. Stern or Tim, about when?
Yeah, latest that we've heard is probably sometime in November. Hopefully it'll be approved by the FDA later this month.
Now, do we think that will be both or all three, Johnson & Johnson and Moderna or Pfizer, or maybe just one of them?
It looks like right now just Pfizer, with Moderna a couple weeks to a month behind. But I think that would make a big difference in the community. Needham has plus 90% vaccination in all of our age groups, except those people under 12 who are not yet eligible for vaccination. Obviously, that's a significant part of the school population. And if those people were vaccinated, the supermajority of everyone in the Needham Public Schools, students and staff, would be vaccinated against COVID.
Well, and I think it's also a signal that the community is taking this seriously, and that if families are willing to make sure that their older children are vaccinated, they themselves are, that sounds like, or the signals are, that they'll be doing the same thing with their younger children, is the hope. Dr. Stern, what are you seeing with COVID in your practice? I'm curious to know, are there many cases coming in? Are you doing a lot of testing? Are young people getting sick? What does that look like?
So I'd say over the summer, we did not see many cases at all. There was an 8-week period that we didn't have any cases of COVID. And then starting in August, that changed a little bit. So there was an uptick with the Delta variant. I'd say now we see maybe anywhere between 3 and 5 positive cases a week in our practice. Not all of our patients are from Needham, so surrounding communities. These kids, fortunately, are not very sick, which is wonderful. They might have cold-like symptoms, low-grade fever, nasal congestion, a little bit of a cough. Sometimes they've been exposed to a known COVID case, but we have not had to hospitalize anyone as a result of a current COVID infection. We have seen a few cases of problems after COVID, maybe 4 to 6 weeks after, but that's very, very rare. So most of these kids have done really great.
So it's happening, but it sounds like mild symptoms, more typical of, for example, a light flu or something
Exactly.
that we're used to. Susanna, in the schools, I think everyone is maybe a little surprised, not anymore, that we're beginning the year in a similar way. I think in June and July, people were throwing their masks away and thinking about a whole new sense of what the school year would look like, but we're not there yet. Although what's really exciting is all of our students are in school, and we're really very much focused on that, as is the state, as we try to prioritize in-person learning for our students. Um, can you comment on a little bit about what are some of the steps we're taking to make sure that healthy students remain in school learning? I know that we're participating in the state testing program. Perhaps you can comment on what that's all about, how that's being rolled out.
Yeah, so the state testing program is comprised of three components: test and stay, symptomatic testing, and pooled testing. The consents are for all three, and that the consent database only allows consent for all three.
So families have to consent
So
to
they
having
have
their
to
student
consent
participate.
prior
Okay.
to participation. At this point, we're only engaging in test and stay, which, there's some confusion about. It's a much more complex landscape with COVID this year than it was last year, right? So test and stay is for, in terms of students, is for unvaccinated students who were exposed in school and have had no symptoms. So with those students, we're able to keep them in school with their parents' consent, test them each day with a Binax test with our partner CIC, who's running the testing program from the state. And then they will wear a mask at all times in school other than when eating and drinking, and be able to participate in their day and then quarantine from public health outside of the school day, because the test and stay program is just DESE and applies to K-12 education rather than, Taekwondo or anything like that.
So let me unpack that a little bit. So DESE, the Department of Elementary and Secondary Education, along with the Department of Public Health, created a program, and our partner from the state is CIC Health, and they're working in schools now. They're on campus, if you will, and they are helping to test students who are unvaccinated, who may have been exposed as a close contact, to test them, and if they are negative, they can return to the classroom. So we're prioritizing keeping kids in school, and it's just for the schoolhouse, really. I know that some families have been a little confused about this from the public health end, because once they leave the schoolhouse, Tim, they still have to quarantine. So explain that.
Sure, and it is a little confusing. It's natural that people might have questions. So the test and stay program is a balance. It is producing what we think is the best policy outcome, which is keeping kids in school, while sacrificing just a little bit in the infection control. And we think with all the other safeguards we have in place, that's a very manageable risk. It basically says that time in school and with school activities is paramount. And so we are going to prioritize that where normally we might have kept kids in quarantine. We're going to say that as long as you don't have symptoms and as long as you keep having a negative test every day, you can still go to school. And I think that's the best outcome for the parents and for their kids. It is not necessarily the absolute strictest public health standard, but it is a reasonable public health standard to balance the goals of having limited COVID spread in the community and having kids in school.
And you said, Susanna, that this is complex. It is actually more than last year, because last year, if you tested positive or you were a close contact, you went home. It was kind of simple, complicated on the learning end, but certainly simple on the medical and public health end. This time around, though, not so much.
Right.
And our nurses are still phoning up and calling about close contacts. And what does that process look like?
I just wanted to say one other thing before we pivot to that question. I just wanted to say that one of the other areas of confusion is, like Tim was saying, that school exposures are very low risk, and so they're able to participate in test and stay. If it's an exposure outside of school, they would need to follow the public health guidance on quarantine and would not be eligible for test and stay.
So sleepovers, youth hockey, activities like that, CCD.
Or a household exposure would need to quarantine.
Right.
In terms of the nurses, they're following up on the attestation fails and working with parents to get students tested as they need to. Another increased complexity this year is the different symptom lists, whether students are vaccinated or unvaccinated. So there's a lot of levels that the nurses are supporting families in, and then also getting those tests back for students who've been quarantined, that day 5 or later PCR, and then helping the students know when they can come back to school.
I didn't say this from the outset, and I should have, that all of this requires a continued strong partnership with their families. If we're prioritizing students being in school, that may mean that they're sacrificing some out-of-school time, at least for several days, and to make sure that they're healthy so they can remain in school. And we depend on families to help us with that and to help manage that. They're depending on us to prioritize their students' learning in school, and so it really is, in some ways, an even tighter and more critical partnership. Our families have been amazing, though. They have been for the last 18 months, and our students, of course, are exceptional and being quite resilient in trying to manage all this unique landscape. I am curious to know where all of us are sitting here right now with masks, and we do have several layers of protocols in the schools to mitigate the health and safety situation, which is why I think schools are good and a safe place to be. And besides masking, we're optimizing space where we can in cafeterias at the elementary level. We have our similar ventilation protocols in place. We have the attestation form. We're really, really pleased that over 95% of our families are completing that form every morning. And that's important because it's a check to make sure that you're feeling well when you come to school. And then, of course, we have the test and stay program that you outlined. Alan, I want to talk to you a little bit about masks. I think it's clear that there are folks who are pleased that masks are in place, and there are those who are, when are we going to get rid of these masks? Mm-hmm. So what's the science say, and where are we at?
So I think, to take a step back, no one likes wearing masks. Masks can be hard to use. They fog up your glasses.
I'm experiencing that this morning.
As am I. No one likes it, but I think what we've really been able to see over the past 18 months is that they work and they work well, especially when they're used correctly. It was really one of the first lines of defense before we had the vaccines available. Now that we have vaccines, that's a wonderful method of protection against the coronavirus. But masks give that extra added layer that we all still need right now. I mean, we know that the Delta variant and possibly the Mu variant and any others that might come along might get through that vaccine protection. So masks do give that extra layer of protection. I think until we're at that state where we realize that this is an endemic type of virus, we probably need to continue wearing those masks to give that extra layer of protection.
The one difference this year is that outside students are allowed to go mask-free unless they're in the test and stay program and they are being tested for 5 to 7 days because of an exposure. And so that we have that latitude that we did not have last year.
Right.
That's helping with recess. That's helping with athletics after
Sure.
school. And yet it is a thing. Masking is a thing that we're trying to manage. And we're fortunate, all of us sit on the Joint Committee on Health and Safety. We meet regularly to talk about the latest science, the data, led by Tim, about local data. And eventually, especially with guidance from the state, we will make some decisions, appropriate decisions about masking. That might take a little longer than we want, but I'm hoping and expecting that it will not be a forever thing. I think we really have to dig into that and balance the risks of wearing a mask with not wearing a mask, and where do we land. Tim, Dr. Stern talked about endemic. I know you've mentioned this a couple times during our Joint Committee on Health and Safety meetings about, we're getting to a point where COVID may be endemic. So first of all, what does endemic mean? And secondly, say a little bit more about what that could mean for the trajectory of this virus.
For our purposes, endemic means sort of present in the community on an ongoing basis. So there is flu, for example, every year. The flu strain might mutate a little bit, but there is flu that we know will come back sort of every year. It hits us in the northern hemisphere during our winter. It hits the southern hemisphere during their winter, which is our summer. So it's a disease that is sort of prevalent in the community. It's not a new or novel disease that is now spreading across the globe, which is what we have with COVID. So it's the transition from an epidemic to an endemic disease. I think for us, part of that transition is already taking place. So with vaccines, we have seen that cases of COVID might go up, but in a vaccinated population, hospitalizations, intubations, ICU stays increase at a much more modest rate. And deaths go up hardly at all. That's what we've seen in Massachusetts, for example, over the last 4 months. And that looks a lot like a seasonal flu disease outlook, as opposed to maybe early COVID, where cases would go up and then hospitalizations would go up just as sharply, and then deaths would go up just as sharply. So the fact that hospitalizations, serious health outcomes, death are decoupled from cases is a good thing. It may seem intuitively, if cases are up, that that's not great. But if not, people aren't getting as sick, people aren't being hospitalized, people aren't dying, that starts to look a lot more like flu, and we manage flu every year.
So it is something that could become, if you will, a part of the landscape where as we get annual flu shots, there could be a COVID shot that we get, or combined. I'd like it to be combined. If you have any influence on that, I prefer they be combined. It'll just be, it'll be a little easier to manage. What about travel? I'm thinking about we have holidays coming up, long weekends coming up, Thanksgiving, Indigenous Peoples Day, Columbus Day, Thanksgiving. What are you thinking about advising your patients and families around travel?
It's a tough one because I think people are wanting to get out and move about, especially if they're vaccinated. But you have to be careful if you're not vaccinated. And the current CDC recommendations are to quarantine for 10 days if you're not vaccinated, should you be traveling. And we used to have these different states that you could go to depending upon the community spread. But now it's pretty much everywhere is considered a hot state or area. So even if you're traveling to other parts of New England, you should still consider quarantining if you're traveling. That is a recommendation.
If you're not vaccinated. So of course we're talking about younger children at this point. Yeah.
Exactly.
Yeah.
One of the things you mentioned, Dan, is it's a partnership between the schools and the town and parents. And I think parents have to balance the need to return things to normal and the need to have nice experiences, family events, but they have to balance it with some safety measures in place. So that might be the case that if Florida is a particular hotspot, maybe you don't choose to go to Florida, maybe you go to Vermont. If you normally participate in a school-based hockey team and 2 or 3 community-based hockey teams, maybe you only focus on the school hockey team instead of sort of spreading yourself out and having exposure to so many more people. It's unfortunate that we're not fully back to normal, but people do have to understand we're not yet there. And the steps they can take to keep themselves safe is by limiting what they do or doing it with a little bit more care than they might in sort of a normal time.
And we also hope that with the vaccine coming out for that 5 to 11 age group, which again, hopefully will begin in November, that most individuals in that age group will be fully vaccinated before the winter holidays. Thanksgiving might be a little tough to be fully vaccinated, but we'll get there.
I'm thinking too that there are, thinking about travel and making those appropriate plans or activities at home. These are some of the challenges we're facing. Susanna, what do you think are some things on the horizon or that you feel is a particular challenge right now in managing your portfolio of students and staff and families, trying to keep them healthy and safe? What's one thing that keeps you up at night? Um,
I think that understanding test and stay has been very challenging for staff and families. And I think that, if families do get a letter about test and stay, if they can read through it and really, really look to understand it and then reach out so that we can prioritize the questions for the nurses who might, be having a large amount of people in that moment to help. And then also to carefully read the email that you will also get from the health department, because that will give you the dates for your child of when they can rejoin jujitsu and Girl Scouts and all of those things. That, if we can really have parents look at those documents carefully and then refer back to them, and then we can support them with any additional questions. That would be great, just as in trying to help support everyone in this new nuanced moment.
So test and stay is a challenge in just the communication, and because it's new, right? Needham was one of the first communities to get it up and running.
Yes.
Some are just beginning to get it up and running. So we're still getting our pacing and our legs.
Yeah, I think
under us.
it's very confusing for people because there's so many nuances to it
Yeah.
of who can participate and how. Sometimes people may think it's testing symptomatic kids and having them stay, but it's not. It's these in school close contacts with no symptoms.
Tim, the same question for you. What keeps you up at night when you think about this 18, 19 months of the pandemic that we've been living through?
I think it is that cooperation with parents when there was when schools were out of session. So that end of June, July, Dr. Stern talked about how he went almost 2 months without seeing COVID cases. When it's adults that have a COVID case and we're doing contact tracing, adults have interactions with 4 to 6 people. When we're doing contact tracing for kids, they have interactions with dozens and dozens of people. And some of those are important and can't change. Their exposure in school is important. We want them to be in the classroom learning. I think the challenge is when they are participating in so many extracurricular activities, that exposure is very broad. And so I think I'm hoping that parents will be a little bit cautious and say, we're going to prioritize these 2 choices and not do 10. It makes it a lot easier on my staff. I think it makes it more helpful for sort of Susanna's team and everyone else when we can understand the exposure and it's a modest exposure. There's only 24 people for a kid instead of 12 people.
Well, I appreciate you encouraging families to kind of downsize the expectations for out-of-school activities. I mean, this is not a forever thing.
No.
This is, for now to really prioritize students being in school, and that may mean some sacrifices on all of the other activities and exposures that they may have. Alan, the same thing to you. What keeps you up at night when you think about this pandemic?
So I think the social and emotional well-being of everyone, not just the students, but faculty, staff, physicians in the community, nurses in the community, it's been very challenging for everyone involved. And I think it's just hard to say to people, it's okay, just keep going, when I think a lot of people are tired of it. But I do see light at the end of the tunnel. And I think a lot of the models are showing that we're going to be, hopefully by March at that endemic period where we can just say, all right, it's part of who we are right now. And maybe we can ditch the masks and feel a lot better about that. But the social and emotional well-being of everyone is a real concern. And we've seen a huge spike in anxiety and depression amongst young people, old people too. So that keeps me up at night.
Yeah. There's no question this has taken a toll. Our healthcare workers, our teachers and staff, certainly our school nurses, and of course our families who are trying to manage this, trying to work from home or get back to work or managing the young children. This has been it's been an extraordinary turn of events for us, around the world. And I think fortunately we live, learn, and work in a community that values children and can come together to say, okay, what do we need to do? And so I think we're resilient in that regard as a community and as staff, and working together that can continue. I'm reminded too, Alan. We've heard from some staff members and families saying that these very masks, they contribute to some of the social or some of the learning challenges that younger children are having, and it's true. Certainly, it's hard to develop strong relationships as you'd like with the mask as a barrier, and yet for our youngest children, it seems like for a while they will be with us. For older children and students, we have to think about that. We have to figure out what's going to make the most sense. But there's no question that working together, we can take all of these concerns that we have and try to continue to prioritize health and safety. As we conclude here, a couple things that you've said are important. It's clear that our priority will remain health and safety of our students and staff. We have some measures in place. We have a high rate of vaccination for our staff and students who are eligible. We have masking protocols. We're optimizing distancing when we can in the cafeterias. We are adopting our ventilation protocols, our attestation program, our test and stay. All of these together are trying to help us keep students in school. And then, as Tim has said so eloquently, the partnership with parents is really key. That working together, and with our older students too, working together, we can get through this thing and go on to the next challenge. The last thing I want to say is thanks to all three of you. Susanna, I appreciate, as I said earlier, that you are on board with us now. I think our nurses and our staff feel really, really great about that. We're glad you found us. And Alan, you've grown several generations of students in Needham and really helped.
Superintendents.
And superintendents, true. Right. The superintendent needs a pediatrician. Absolutely. Absolutely. And some pediatric care. So thanks for all that you're doing and your steady and very low-key advice, which is very much appreciated. And of course, Tim, what the public health nurses are doing and your staff to keep the community safe is exceptional. So I appreciate all that. We'll keep focusing on health and safety, and thanks for joining me today.
Thank you.
Thank you.